Hello students, now let's start our lesson. The theme of our lesson is health and health problems.
Okay, so I'd like to start with a slide presentation which is named Health and Health Problems. And first of all, let's make a discussion on the following question, which sound like, can you list some health problems people commonly have? So please think about it. And so, in fact, physical activity and nutrition could be considered one of the most popular health problems of people. Research indicates that staying physically active can help prevent or delay certain diseases, including some cancers, heart disease, and diabetes, and also relieve depression and improve mood. And activity often accompanies advancing age, but it does not have to. Check with your local churches or synagogues, senior centers, and shopping malls for exercise and walking programs. Like exercise, your eating habits are often not good if you live and eat alone. It is important for a successful aging to eat foods rich in nutrients and avoid the empty calories in candy and sweets. Overweight and obesity is also in here. Being overweight or obese increases your chance of dying from hypertension, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, osteoarthritis, sleep apnea, respiratory problems, dyslipidemia, and endometrial, breast, prostate, and colon cancers. In-depth guides and practical advice about obesity are actually available from the National Heartline and Blood Institute of the National Institutes of Health. I guess that tobacco is the third most common one. This is the single greatest preventable cause of illness and premature death in the United States. Tobacco use is now called tobacco dependence disease. The Centers for Disease Control and Prevention, which are also known as CDC, says that smokers who try to quit are more successful when they have the support of their physician. So please look at the screen now. Due to the picture, choose a suitable vocabulary. I'll give you some time for observing each photo, then I will share the answer. So the answer is nosebleed. Next, how do you think what it is? It is actually cough. Next, this one. It is back pain. What about this? It is cold. How do you think? What about this one? That's sore throat. And the last one is, that's sprain. Good job. And now, please pay your attention to the following questions. Have you ever experienced any of them? Which one? The next question is, what do you usually do when you have a health problem, and why? In fact, in these cases, your first step should be to reach out to a crisis line or helpline. It is for free and confidential support if you are in distress or crisis. If you are experiencing a medical emergency, then you should call 911 or your local emergency number. You can get referrals from your family doctor, cleric, or local mental health office, which also may provide mental health care services, and crisis centers as well. Your insurance company can provide a list of providers who are in your pain. Next question sounds like, how often do you seek for medical help? Frankly speaking, you should know when to seek. It seems like it's always difficult to determine when you should see a doctor. With flu season right around the corner, it is wise to be reminded of when we should seek medical attention. In children, emergency warning signs that need urgent medical attention could include fast breathing or trouble breathing, bluish or gray skin color, not drinking enough fluids, severe or persistent vomiting, not waking up or interacting, being so irritable that the child does not want to be held, Flu-like symptoms improve but then return with fever and worse cough. In adults, emergency warning signs that need urgent medical attention could include difficulty breathing or shortness of breath, pain or pressure in the chest or abdomen, sudden dizziness, confusion, severe or persistent vomiting. Flu-like symptoms improve but then return with fever and worse cough. Then the last question is, have you ever searched for medical advice in websites? If so, was the information useful? In fact, none of those who use the internet for health or healthcare information retrieval say that the internet information helped to better understand their symptoms and their planned treatment. Only one respondent found their information helpful to manage their own condition. Even if a health website looks legitimate, it does not necessarily mean that the advice has been provided by someone who is qualified to do so. Some websites appear to be trustworthy and authentic. However, in reality, they are run by people with no medical credentials. How internet is useful in health and medicine. In clinical settings, the internet enables care providers to gain rapid access to information that can aid in the diagnosis of health conditions or the development of suitable treatment plans. It can make patient records, test results, and practice guidelines accessible from the examination room. Okay, so at the end, please try to write the pros and cons of health problems. Think and share your opinion. As a home task, you'll prepare to the role playing. That's all for today. Thank you all for today's lesson, and goodbye.